Okay. So prescription writing is a very important station of PLAB 2 exam, and it is a very good station in terms of getting very good marks if you have done it in a very good way. It's just like mathematics. If you have done it in a very good way, in a proper way, then you can even score 12 out of 12. Same like teaching station. Uh, I know these are hard stations for most of us, and we are scared of them. But believe me, it's not about your knowledge, it's about your skills, how well you are going to, approach these stations. Okay. So let's do some general tips before we are going specifically at the prescription. So whatever you are writing, it should be in block capitals, and you should be using black ballpoint. Sometimes in order to confuse you, there will be different colored ink pens over there. For example, blue, for example, green. So you should be knowing about it. You have to pick up only the black ballpoint. And because we use black ink most of the time in the hospital while we are writing our notes, while we are writing the prescription, green is for pharmacy. And in order to confuse you, they can give different kinds of pens, so it is important as well. After that, patient names, NHS number, everything about the patient should be written on every sheet. Usually when we are writing down the prescription or any notes, any documentation, there should be a three-way of identification: patient name, date of birth, NHS number, or hospital number, so that we are not messing anything up. Third thing is drug sensitivity. Whatever you are prescribing, please make sure patient is not sensitive to that particular drug. One of the example is in the real exam, when you are getting a station where you have to prescribe antibiotic, and for example, they ask you to prescribe amoxicillin, but in the in your statement, in your task, it's written somewhere that patient is penicillin allergic. So you should be using presence of mind. You should be knowing about it. Since this patient is allergic to penicillin, you can't give this patient penicillin. And sometimes it might mention about allergy, like it's a mild kind of allergy, moderate or severe allergy. But even if it's not mentioned, because at PLAB 2 level, they don't expect this much things. So for example, if patient is allergic to penicillin, you should be using an alternative thing for that. For example, if you are giving penicillin for chest infection, so alternative to it can be clarithromycin. But if you want to be on safe side, you can just verbalize this, that I will discuss with my senior to give some alternative drug. We will discuss about this example in detail. So next thing is use generic name instead of brand names. Okay, in all the drugs, wherever possible, please use generic names, not the brand names. Exception is insulin. So when we are talking about diabetic medication, in that case, specifically different types of insulin, in those cases, we will just use the generic names because their formulation is different. Otherwise, it's always advisable. Someone is talking, please mute yourself, to use a generic name. If it is, for example, clarithromycin and the brand name is Claricet, avoid writing Claricet instead of clarithromycin. You should be writing the doses correctly, 1 and 2. Sometimes when people write it, I have recently seen a prescription few days back, and 2 was written exactly like somebody can confuse it with 1. So sometimes minor changes can make big blunders in terms of patient management. For example, if it is, for example, bisoprolol, you have written 1.5 milligram, and somebody has read it as 2.5 milligram. It will be a very change dose for the patient, and you will be in trouble for that later on. Regarding abbreviations, some of the abbreviations are acceptable. For example, G instead of grams and mg instead of milligrams. But when you are talking about microgram, please don't write micrograms. Similarly, when you are talking about units, for example, if you are prescribing insulin and you have to write 16 units, avoid writing U. Instead of that, write whole units, because somebody can easily misinterpret them and can give the wrong thing instead of that. Okay. Next thing is that use numbers or figures to denote use of a sachet. For example, when we are prescribing Lexido, so in sachets, everything is at a proper proportion, but because it's a standard formulation, so instead of writing everything again and again or separately, we just write one sachet, two sachet. Okay. And then is the use of inhaled drugs like steroids. In addition to stating 2 puffs, as strength can vary. Always use doses instead of writing 2 puffs, right? Because strength can be different. Always write the dose. For example, 500 microgram, 1000 microgram, or whatever is the dose written in your task. Okay, so different kinds of abbreviation you can see in the task. OD is for once daily, BD is for twice daily, TDS is for thrice daily, QDS is for 4 times, MANE, if you see it somewhere, it will be morning. Sometimes you can see ON as well. ON is also once daily, like OD. And PRN is as required. So as required medication, for example, when we are writing painkillers, so some of them will be as PRN and some of them will be in the regular column of prescription. And when you are writing PRN medication, you have to write exact instruction. For example, when we are giving paracetamol as PRN, we can write it as paracetamol 1 gram is the dose, and the instruction will be up to how many times you can give or how frequently you can give. For example, 4 to 6 hourly, or some of the painkillers when we are prescribing. For example, it's a common practice to prescribe oral morphine in clinical practice, and it is prescribed as 2 to 4 hourly. So we have to write exact instruction for the nursing staff so that they are not giving the drug in more than the amount that is required by the patient. Somebody raised the hand. If there is any question, you can ask me. Any question till now?
No, sorry.
Okay, no worries. Okay, so this thing is very important, the basic patient info, because if this info is wrong, then a lot of things can happen. Your patient cannot get the drug, the wrong medication can be given to somebody else. So it is very important to check this thing. Can you please mute yourself? Sometimes in the exam, there will be a sticker sheet. So it's very confusing for some people when they see sticker sheet, because if I'm telling you, okay, you have to write down hospital number, you have to write down the name, you have to write down the address, date of birth, and NHS number. But in exam, instead of all these things, is there can be a single sticker mentioning all the stuff, or there are separate things. For example, 3 different stickers. One is showing hospital number, one is showing name, one is showing address. So no need to be confused. Just put the stickers at the relevant column. For allergies and sensitivity, if you look at this thing, this is the identification detail that we were discussing. After that, if you know the ward, you can write it down here. If you know the hospital, you can write it down here. Otherwise, it's fine. Date of admission, if it is mentioned, you can write it down here. And here you will write the date of your exam when you are filling the chart. Somebody is talking. Okay, so After that is the allergy status of the patient. So most of the time it will be mentioned in the task if patient is allergic to something. Most common allergy is penicillin allergy. It can be to anything. It can be even to paracetamol. So whatever you are writing, make sure patient is not allergic to that particular thing. And if it is allergy, then if you know the reaction, well and good. Otherwise, it's fine. Okay. So after that, important information will be in your task. So for example, the task is this one. Name is Mr. John Smith, date of birth, hospital number, NHS number, address, allergy, comorbidities. I want all of you to write down this information in your PDF file if you have a printout of that, or if you don't have a printout, then you can just have a look at your PDF file, the soft copy, and let me know if there is any problem in this section. We are just considering this section for the time being.
From another dimension, another world. Archaeologist Dr. June Moore wandered into the wrong cave.
If there is any problem, you can ask me. So if not, then we can move to the next part.
Dr. Kurat, I have a question.
Yes.
Where do I write these comorbidities, COPD and hypertension?
Give me a second. It's not here. So most of the time, these comorbidities are not mentioned here in the prescription writing task, in prescription writing chart, but you should be knowing about it. I will tell you the reason later, okay?
Okay, thank you very much.
Doctor, if the patient don't have any allergy to anything, then what should we write in that field?
You can write NKDA, no known drug allergy. Otherwise, you can write nil as well. NKDA
Okay.
means no known drug allergy. Mostly we write this.
Okay, thank you.
You're welcome.
And when we're filling the allergy section, the name is our name and signature is my signature, the doctor's writing? In the allergy section, there's a
yes,
area. Yeah,
yes.
okay,
Yeah, here.
thank you.
Because somebody has to check the allergies.
Dr. Kurat, you said you have to write everything in a capital letter. Do we need to fill the patient details as well in capital letter?
No, it's not needed in capital letter. But in the exam, most of the time there are stickers. So you just have to put the right sticker at the right column, okay? But this is fine if you are not writing in capital letter.
Doctor, I didn't get the stickers part.
Sorry?
I didn't get the sticker part. There will be stickers that we have to stick on the prescription sheet?
Yes, there can be stickers as well. Yes. So at this column, there can be stickers and you can put the stickers here. It will make your job easier. It will be quicker as compared to writing whole stuff. But sometimes they can give you stickers, sometimes there will be no stickers, okay?
Okay, okay.
Doctor,
Yes.
yeah, in the allergy section, there is a column which is type of reaction.
Yes.
What kind of reaction we can mention?
If it's mentioned in your task, then you can mention. If you are not sure, then you can just you can't fill it, right? Because sometimes it is mild reaction like rash. It's mentioned in the task. If it is not, then don't fill it because you don't know the reaction. If you have a patient, then obviously you can ask the patient before prescribing what kind of reaction you had with penicillin. But if you are not, because in prescription writing stations, they give you these kind of stations in two different ways. Sometimes patient will be in the cubicle, sometimes patient will not be in the cubicle. Okay, so if patient is not in the cubicle, then obviously you can't ask these kind of question. But if patient is in the cubicle, then you can ask it if it was a mild allergy, moderate allergy, or severe allergy, and what kind of reaction was that.
Okay. And I have another question.
Yes.
In the start, there is a column of consultant. This should be filled by us, or we should leave it.
I think for exam purpose, there will be no name, so you can leave it.
Okay.
The main thing is, apart after this identification part, and the next important thing is allergy part. Okay, fill that out. Now comes the main part of the prescription writing. So if you have a look at the PDF file, you will see there are different sections. First section is mostly on a drug chart is once only medication. For example, we are giving something, for example, we are giving phosphate enema for only one time, then we can write here on the first page, once only. Okay. Another portion of the drug chart will be antibiotics only. So you will prescribe antibiotics only on the antibiotics part of the prescription. You cannot prescribe antibiotics in the regular medication part. Okay. So then there is a separate portion for regular medications. Whatever medication patient is taking regularly in the past, and if you are adding on some medication as a regular one. For example, when we have a patient admitted in the ward, and patient is having a new heart problem, and more things, or patient was diagnosed with hypertension, and we have added some antihypertensives as a regular medication, write them in the regular medication part, not in once only or as required part. Okay, so next is the as required portion of the drug chart. In as required portion, most of the time, painkillers, antiemetics, these are the things which are written here. And then comes anticoagulant portion of the chart. And as evident, enoxaparin, for example, if it is treatment dose, if it is prophylactic dose, it will be written here. If you have any warfarin, Caban, rivaroxaban, any kind of anticoagulation prescribed, then you have to write it in the anticoagulation portion, not in the regular or any other portion of the chart. Is it clear till now? Now we will,
Dr. Kurat, just quick question. So if the patient's on medication at home when they come to us for previous medical conditions, those medication will be put in the regular section, the regular.
yes,
Okay.
patient is taking it regularly previously.
Okay. Okay.
In these
Thank you.
kind of tasks, sometimes the regular medication will be given in the task, but sometimes these medication will not be given in the task. So how will you know if patient is taking anything? These comorbidity section. Okay.
Okay.
Patient is
Okay.
COPD, so you will ask the patient if he is taking anything for that, and if patient is taking, for example, blue and brown inhaler or only brown inhaler or anything, then you can write it down in the regular. You can ask the patient because he is taking it regularly, so he will be able to tell the correct dose and frequency and everything basically.
Okay. Thank you.
And if patient is hypertensive, it is mentioned here, and you don't have the record of hypertension in your task, then you can ask him if he's taking anything for that. Now here is the task one. So you are FY2 in acute medical unit, and this is a 60 years old patient who is a known case of COPD. He presented to A&E with breathlessness and productive cough at night. He has been shifted to AMU, and then he was diagnosed with chest infection and exacerbation of COPD. Patient is allergic to penicillin. That is an important thing. And the reaction to it is rash. So have you got the answer for this? What will you write?
Yes.
And then your consultant has seen the patient and decided to start him on clarithromycin 500 milligram tablet BD for 7 days. So is clarithromycin a regular medication? Which kind? If I ask somebody to tell me on which portion of the drug chart you will write clarithromycin. out of these?
Antibiotic.
Yeah, perfect.
Antibiotic.
Perfect. And please prescribe his medications in his drug chart. You can find the list of medication inside. Sometimes there is patient inside the cubicle as well. So there are different variation of this task. Okay. Sometimes instead of clarithromycin here, they will tell you prescribe coamoxiclav, clav 625 milligram tablets TDS to the patient. But you know that this patient is allergic to penicillin. So can you prescribe coamoxiclav to this patient? Obviously, no. You have to think of an alternative. So in order to check your presence of mind, they can write it down. So you need to make sure you are not giving anything that is harmful for the patient. List of the medication can be inside like this. And sometimes some of the things might be missing. For example, this is the full task now. The task we have discussed, this is the full task now. For example, they have given everything else, but they have missed this salbutamol and this seretide inhaler. And everything else is written. So you can ask the patient, because you know patient is COPD, patient is hypertensive, so you can confirm with the patient if patient is inside the cubicle. If patient is not inside the cubicle, then everything will be written in the task. Obviously, you don't have anyone to speak to. But if patient is there, then sometimes they can miss this information. So you have to ask the patient and he will tell you, okay, I'm okay. And there is another twist in the task. Can someone figure it out and tell me? Please read the task and tell me about another twist in the task. We should be careful about that thing.
Patient is on clarithromycin and atorvastatin.
Yeah.
Dose of atorvastatin is not correct. It's supposed to be 20, I believe.
It can be 30, but another thing that we can't give statin and clarithrol together because they cross react.
Yeah, that's correct.
So we need to give clarithrol for 7 days, and in that period we have to stop statin tablets. And once those 7 days are over, we have to restart statins. We can't give them together. Okay, so this is the task for you guys, and I will give you 5 minutes to write down these medications at the right portion of the drug chart, and then let me know once you are done. I will give you 5 minutes from now.
You're not going to talk to anyone. Just look at the
In fact, you can write down the medication in your drug chart, and I can start a new meeting in the meantime because this meeting will be finished in 10 minutes. And then we can discuss if there is any problem.